talking about prostate health and prostate cancer, there are a lot of men out there as they get to their 50s. They start having slow urinary stream. They're getting up in the middle of the night. They think this is normal. They think this is part of the aging, and as you get older, it's normal to get up 2-3 times. But in reality, as your prostate is getting larger, and your bladder ends up like working a lot harder to get the urine out. So the bladder can become thicker, and as a result, you may end up having bladder stones or infections or even sometimes bleeding, blood in urine, which we call it hematuria. None of this stuff is really normal. It's not part of aging. And when you prevent it early on, whether it's through herbals or whether through medications, or there are procedures that we do in the operating room, minimal invasive procedures such as green light lasers or bipolar terps, it can really open up a nice channel. It makes you empty your bladder well. It prevents any kind of infection in your kidneys. And that's really important. It's good for you to know this stuff. So we're dealing with prostate cancer. And we talked about the fact that you need to know what your PSA is. And by the way, besides PSA, there are also a lot of other tests that we're offering in the center. There's something called 4K test, which is a series of these different derivatives of PSA. There is a urine test called PCA3, which is also by shedding cells in the urine, we can check to see if there are any samples there. There are genetic testing that we do, and also, of course, digital rectal exam and the MRIs. But you may also have other problems with your prostate, something called inflammation of the prostate, prostatitis, which results in a lot of perineal pains, difficulty with your, again, urination. And when you see like a full-blown prostatitis, I mean, these guys are completely miserable. And we see this in men in their 20s and 30s. And sometimes the antibiotics is the answer, but sometimes a lot of anti-inflammatory, change of diet, change of lifestyle is a way to go. So you need to know about these things, and that's really important.